Louise, I'm a dietitian. I've been working at Airedale for about 18 months now. I focus mainly on people who are losing weight. We know that malnourished people are more likely to end up in hospital, and when they do end up in hospital they get more complications and their death rates are higher than in people who are well nourished. So I work with them at home mainly, but also in hospital, and I work with their carers, trying to improve the quality of their diet so it can help keep the weight steady. In addition to my patient work, I also do lots of training sessions with community teams, so nursing teams and teams of home care providers who actually go into people's homes to try and help them recognise malnutrition and to know what to actually do so they can treat malnutrition. At the time I wasn't actually looking for a job change, but somebody showed me the job and the job seemed right up my street. The location was really good, and when I came for an interview it just seemed such a friendly environment. Somebody who loves the outdoors, then Airedale's perfectly situated for lovely countryside, but also with easy access to the city if we want it. For me it's a great place to work and I've never looked back. I was told that Airedale has a reputation for being very innovative, and it really is. I hear the word yes a lot. Whenever I have ideas, people say yes, yes, go ahead with that. People don't put barriers up against the work that I want to do. The dietitians team here are a really good, friendly bunch of people. I've got great support from my line manager, and I'm also given a lot of autonomy, so I can do my own thing to an extent, but when I need the support, it's there. I've done quite a lot of different projects. I spent quite a bit of time exploring the role of nutrition and hydration in reducing falls risk. And as a result of this, we found out that people who were better nourished fall less, people who are better hydrated fall less, and people who have better vitamin D status fall less. So we had lots of conversations with people in the hospital. So now we're trying to spread the word around teams both in the hospital and in the community, and make sure that when people are looking at falls, they also think about the nutrition and hydration part of that. Such a big project. I ended up writing it up in one of our dietitian magazines. So I did an article for this magazine called Complete Nutrition. So that's therefore gone out national to dietitians throughout the country, so hopefully they'll be able to use that information to reduce falls risks in other hospitals as well. Just thinking about why would somebody else want to come and work here? Well, for me it's all about working in a supportive and encouraging environment. I've been allowed to run with my ideas, and this has released a real creative streak that I never knew I had. Of course, we all have our different strengths and weaknesses, but the main thing is that we're given support and time to learn and develop. Some people think you don't get many opportunities when you're working in a small hospital, but I found the opposite to be the case for me. I've never had so many opportunities and such great support from my colleagues.